Hello and welcome to the 2025 Advocacy video series presented by the Nevada Minority Health and Equity Coalition. My name is Alicia Love, and I am a graduate level student intern in the MSW program at UNR. This series is intended to bring light to the impacts of recent changes and challenges in the public health and social services space, as well as getting to the heart of why we continue to serve those in need and to inspire hope in the community as we resiliently navigate these changes and challenges. Today we have with us Kendall Lyons, who currently works for IQVIA, supporting AI research projects, sports injury analytics, and global clinical trials, and is a founder of Pride Data Insights, where she and her team use the power of data to support partners in achieving their organizational program and project objectives. Kendall formerly served as the Director of Health Policy for Children's Advocacy Alliance, as well as an epidemiologist for the CDC Foundation, where she worked with the Nevada State Immunization Program in analyzing and understanding their routine childhood immunization rates and vaccination programs. Kendall, thank you so much for joining me today. Can you please introduce yourself and tell us your story? What inspired you to get into this line of work?
Sure. Well, thanks for having me, Alicia. It's great to be here. Um, as you so eloquently introduced me, I'm Kendall Lyons. I'm the Director of Analytics and Evaluation for Pride Data Insights. We are a women and minority-owned business that really works to create collaborative partnerships with organizations and support them in advancing health equity, programmatic objectives, as well as public health policy advocacy through data-driven solutions. As I mentioned, we really try to build these authentic collaborative partnerships so that we can help these organizations achieve their objectives. What got me involved in public health is this really roundabout story that I'm going to make very concise, but it really started with my BA in psychology. I knew it was not a terminal degree, and shortly after obtaining it, had begun working as a community health worker here in Las Vegas, Nevada. And this was at a time when community health workers were like novel concepts to healthcare infrastructure and patient-centered care models. And so as I was working in this really direct way with patients in our community and how they were trying to navigate and access their healthcare, I just became really enamored with the systems at play that were either providing resources, like so many of the organizations that participate in the coalition, or were erecting barriers, which I felt like policy was really important to try and mitigate and remove. So I decided to pursue my MPH. I fell in love with data because I love puzzling, and data helps me puzzle solutions together. And, I've found throughout my career that I've worked in various aspects of public health, from the community-based public health work of like direct to community members and patients, to working at more of a systems level. And then, as you mentioned, working directly in policy to try and expand Medicaid here in our state. So I feel like I've hit a lot of different areas of public health that have then landed me to where I am today, where I have this, perspective of, various domains, whether that's, from the patient's perspective to how do we, support policymakers to understand certain issues, using data, of course, and also like how do we then try to move systems that for as many years as we may have been working in this area have never really wanted to move or seem impossible to move. So that's a little bit about me, and how I got interested in doing what I do.
Thank you so much for sharing that. I feel like in my internship with the Nevada Minority Health and Equity Coalition, I've had the opportunity to interact with many different aspects of public health too. So I very much understand the value of that and how much it can inspire you to really get into like a broad spectrum kind of role. I also love puzzling myself and data and am very analytical like that. So I feel like we're of like mind in that aspect. Can you tell me a little bit more about the work you're doing on a day-to-day basis?
Sure. Um, like we mentioned, as we mentioned earlier, data I feel is one of the things that across any area of public health is what's driving, certain focuses. And so at Pride Data Insights, we primarily work with nonprofits, with community-based organizations, and other public health agencies that are really focused on serving communities that are disproportionately impacted by health disparities. So our services really span from evaluation design. We create data collection tools. We provide analysis. We provide visualization because you can have all the data in the world, but you need to be able to put it together so that you can tell the story. Like, why does any of this matter? And so, on a day-to-day basis, we're working really closely with our clients to understand what they're trying to achieve in the communities that they're trying to serve. How do we empower them to collect the data that they need? And whether that's creating tools, bringing up their own data literacy, and improving that, or improving their technical capabilities of, working in various tools and understanding different visualizations. Um, so we're doing a lot of really close collaboration with our partners on a day-to-day basis, communicating with them frequently to not only understand, but also build an infrastructure for them that allows them to collect the information they need so that they can then go out and talk to policymakers and tell them why it's really important to enact a certain policy. And we also want to make sure that we provide evidence for why they're important. So part of the work that we're doing is not just collecting their data and giving it to them in a story so they can go talk to policymakers, but also, showing how they're able to actually achieve the objectives that they set out so that they can continue going out and getting funding and, continue their work and expand their work.
That's incredible. I didn't even know that this was something that was going on, I guess. I'm on the other side of it in all of the research that I'm doing. It's kind of interesting to hear, well, it's very interesting to hear what the other side, the data collection and compilation and how the data can be used. Uh, Incredibly interesting.
Thank you.
I might look into doing this myself.
It's very, very exciting. Pride Data Insights was really like this, just one day, just this thought between a colleague and me, sitting around being like, we love going out and finding data, putting it into a story, like analyzing it. We loved working together so much, and so we created this business, and then we've been able to connect with not only organizations here in Nevada, but organizations that are national, but are working in California, and have this ability to bring learnings between these two states to support organizations doing different things. So it's a lot of fun, and I feel very, very fortunate to have a great team and and also to just be doing something that I really enjoy doing and have the impact that we're capable of having from behind the scenes.
I love what you said about the story that the data is telling. That's a really nice way to frame it, a really good way to think about it. So, given the recent changes to public policy, and I'm sure you have a pretty unique perspective on the impacts to the work we are doing and the populations that we serve. Can you tell us any impacts you've already experienced or any that you anticipate going forward?
Ooh. Oh, there's so much meat in this question. I think what I want to start with is that I want to start by saying that when I got into public health, I was really interested in vaccination, which even before our current administration had been a hot topic. And so I feel like I'm no stranger to the idea that people and narratives have shifted into really focusing and highlighting the resistance to data, science, evidence. It's not new in public health, but public health is under attack in a different way than it has been since I've entered the career path that is public health. And so, coming from an immunization space and a vaccination space, I would say that like I'm really not surprised, but I'm also not discouraged as much as it can feel. Like it feels very disheartening, number one. Like I won't deny that. But I feel like the strategy remains the same, and that is that data supports facts, and it's a lot harder to dismiss facts than it is opinions. Like we can much more easily dismiss someone's opinion about something, but we can constantly reframe the data to reach the populations, reach the communities, reach the policymakers that it needs to reach to enact the change. As far as something that I've had to navigate within our own organization, when we started Pride Data Insights, being women owned, being minority owned, and being public health advocates that have been working in equity space, it was so vital to our like ethos that equity be at the center of what we do that like we wrote it into our operational agreement, we made it part of our vision. And this was, starting Pride Data Insights in 2022, and here we are, we're in 2025, and it's like DEI is under attack. And one of the things that we had to navigate was like meeting the moment. What are we going to do as a small business that wants to go out and pursue and prosper in what we're trying to do? Like how do we go out and collect new business? Do we shy away from the fact that we are so focused in equity, or do we lean into it? And we had to have that moment. We had to meet that moment. And it was a really interesting experience that like you have this idea of who you're going to be when a moment comes up, and then the moment happens and you're like, wait, yeah, should I don't know, and you start doubting yourself. And fortunately, I feel very grateful for the fact that like ultimately when we were tasked with like, okay, we're not going to shy away from equity, we're not going to remove it from our portfolio, we're not going to remove it from our missions, we're not going to do those things so that we can meet partners. Instead, we're going to continue pushing those things that are important to us, and we'll have the partners that are meant to be our partners. And I feel very grateful for the fact that it hasn't deterred us, and we're fortunate in that way. And I want to be very mindful of the fact that, like, not all of the organizations and people working in this space have that same luxury. And so, very roundabout way to say that like yes, we are navigating like a time where the work we're doing is has always been under attack, but the thing that everyone's focusing on is not going to stop the work that we're doing. Like it's not gonna change the fact that like we're still going to use data, and we're still going to support what the doctors say, what the scientists say. Like none of that is going to change. um, Even though the banner in which we might be doing it under has to shift or has to adjust and adapt, if that makes sense.
I like that. You have to meet the moment, meeting the moment. So thank you for sharing that. I have gotten similar messages in my other interviews. I think that one of the kind of unintentional, unexpected inspirations that I've gotten from doing these interviews is how people are still so passionate and dedicated and willing to do the right thing and stay the course,
Mm,
even though, like you said, we're under attack. I've seen so much bravery and courage in every person that I've interviewed. And I really think that that speaks to the heart of what this field is about. And all of these people in public health have so much to give and such good values and are such good people. So thank
yeah,
you for sharing that. It really, hearing that really just puts my heart at ease.
I hope it does for those that are currently going through their public health programs as well. It's like especially as a Black woman, it's like none of this feels very, like all of it feels new, but none of it feels new, if that makes sense. And, in my mind, it's like, if it wasn't about the fact that, the word equity is in it, it would be about the fact that it costs money. And so it's like we're always having to navigate one challenge or another. And, some of this is not new. It feels more instead, I think, like the whiplash of the boomerang, where we came from a moment where because there was spotlight and attention in race issues in our country. And we had like this huge push from like not just individuals, but from corporations even to really center these voices. And then we get this, administration that wants to silence these voices or like, push them back into the shadows that they used to live in. And then seeing that like the swing of that pendulum, it feels like a gut punch to all of us who have been doing the work before then and throughout, and feeling like, oh, we finally got these champions on our side and now they're disappearing. And so I know what it feels like to feel like that devastation. And I think like in the months since directive orders and executive orders have come down, it's like at the end of the day, what I've come to realize is that we're still fighting the same fight. Like nothing has actually changed because the same people who were skeptical of evidence are still skeptical of evidence, whether you are framing it from a health equity perspective or not. And so we still need to continue doing that work. So that's kind of my take on where things are right now. And it's definitely a lot different. I feel like I've definitely grown into this take over the course of months. Whereas it was probably a little bit more devastating when it was first happening. So
That's actually one of my mantras is the pendulum will swing back. The pendulum will swing back.
oh, it does.
So, can you share any ways that you are staying hopeful and any advice for fellow advocates for them to stay hopeful during these trying times?
Advice for advocates and piece of advice for my staying hopeful. Um, it's like I want to bring this a little like, back to data. I think one of the projects that we recently worked on was we partnered with the Children's Advocacy Alliance to release their Nevada Child and Family Data Book for 2025. And as we looked at the state of Nevada across a number of metrics, it can feel very gloomy sometimes, especially because our vulnerable populations of children are involved. And, in an ideal state, we want everyone to have access to food. We want everyone to have access to affordable housing. Like in an ideal world, that I feel like is something we should all want. And it's certainly something that I want and those who are advocating on behalf of children want. And so that project really highlighted that there's a lot of work to do, but it also allowed me to take this like longer arc view. And there were areas where it's like because there was data available, I could see where Nevada had made progress and I could see where the nation had made progress. And I could also see like areas where we really need to dig in to continue pushing for change. And so to your question of like, what's keeping me hopeful? One, it's that data is still accessible. It's still going to tell a story. And I was really, I guess, excited about the reception from people who are in the community, policymakers, to being able to have a resource that they could point to that could help them navigate like what issue to tackle next. And so what makes me hopeful is that for the most part, we have data available. We might have to go to local and, we might have to, use older, data is always behind. So, we use data that is accessible and reliable. But because data is available across a number of different areas and domains, like we can put together the story of what do we need to, bridge the gap for children, families, adults, and the community of Nevadans that deserve to live a happier, healthier life. So I guess that was like a piece of work I'm doing that's like making me hopeful. As far as a piece of advice that I would share, I would say like don't be shy to lead with evidence, but really try to speak with empathy. I learned this a lot in my work with like immunizations. I think it was very easy to be caught in an echo chamber of like people who are vaccine hesitant, they're dumb, they're uninformed, they're wrong, right? And like to really kind of dig into, we're just going to pile more evidence on top of vaccinations to explain why it's important. But I found it was like more important to come at those conversations with like a little bit of a humility perspective and framework. And so we shouldn't shy away from pushing evidence and like really expressing the fact that like we are not going to promote bad science, but we have to continue to find tactics and approaches that really try to put empathy at the forefront. Like data can open doors, but stories are really what is going to move people. And I think like when you can move someone's spirit, when you can move their like heart, the mind will follow eventually. And so the only way you can do that is if you like are willing to ask people like why explain it to me, help me understand, and then you can introduce data and the evidence to kind of start moving people to just maybe question why themselves.
That was wonderful. Thank you so much. That was the final question, though. So thank you so much for taking time to meet with me today. And for those tuning in, thank you so much for hearing Kendall's story. Please like, subscribe, and share, and check out the other videos in this series.
Thank you so much. It was so nice to share a little bit of my story and passion for public health with you, and to know that I am in a great group of colleagues with the Nevada Minority Health and Equity Coalition.